there are those that say that we don't need to change medicine or the rest of our society, and yet we have not eradicated a disease. Not in the tradition of Louis Pasteur, not in the tradition of Edward Jenner, who's a noted scientist of the 18th century. Not since Jonas Salk. We've seen an increase in the number of what we'd have to describe as quantum physics events, particularly as it pertains to infectious disease, especially foodborne parasites. And we're talking about Canidia, Salmonella, E. coli, of which are pandemic. It's really important because the presence and stubbornness of these foodborne parasites is an extranatural finding, is a quantum physics finding, not often articulated that way. People that follow the industry describe outbreaks, pandemics, and use alarmist language, partially because there's alarmist results, and we don't see the same kind of results in other parts of medicine. And so pulling out a new medical specialty based on surface areas is really important. Surface areas, in the Gheuic tradition, of which Gheuic comes from the ancient Jagphetic word meaning to pour. There's other quality management philosophies that insist that smaller batch sizes are better. That happens to not be true as it pertains to infectious disease, where simultaneous broad action across all the surface areas, if you can think about your hospital, your clinic, your surgery center, your footwear are part of the surface area of the floor. And, your hands are part of the surface area of all the buttons and switches and all the technology. And so that's why it's so important to have a systematic pour-over approach, which is the ancient Jagphetic word, the Horse Shepherd word, Gheuic. There's professions out there in the field like architecture, general contracting, retail, chemical companies, logistics companies that are making medical decisions for surface areas in our society, in our culture, often bucking the trend and tradition in our 66 shepherd traditions of hygiene, of cleanliness. And that has to be incredibly important because architecture, general contracting have to be under a medical specialty. You could call it environmental health. You could call it public health. Gheuic is really the right medical specialty of what ways with which a building can become cleaned. The surfaces, the surface areas, and the fluids in it. The water, the liquids, and in physics we describe atmosphere as a fluid. That's why we use Gheuic, pour over to describe all three phases of matter. And so we want you to join us in a Jagiellonian law of Gheuic medical specialty. Species are an irreducible thing. The order of species are an irreducible thing. That happens to be an incredibly important quantum physics find, is that there is an order of species like a hierarchy, and that maybe foodborne parasites found themselves higher than Homo sapien in that order of species. That finding is so stubborn and consistent as you look back through history that we have to do something about it. The second Jagiellonian law of this Gheuic medical specialty is microorganisms are different than dirty. When we look at our surface areas, there's a distinction between dirty and devoid of microorganisms. We often commingle the two. Microorganisms happen to not be visible. There's examples where a very large number of microorganisms can be visible, but you would need a microscope to be able to diagnose microorganisms everywhere that they exist. Of which that means we need a cleaning system and a surveillance system, which is that's Gheuic medicine. It's the pour over technology over all of our surface areas in hospitals and clinics and the rest of society, because that's how we end up eradicating disease, is not leaving it to the restaurant association to make decisions on healthcare. And no disrespect, because the restaurant association is an industry that's done something. The screening for parasites needs to be more routine. Parasites are one of the root causes for almost all diseases. And so getting parasites off of our surface areas and safely remove them from our bodies is the first system. And so we want to help architects, general contractors, landlords, occupants of buildings with a master facility plan in light of the Gheuic medical specialty. We know that the science of Gheuic medicine is out there. It's an ancient tradition which traces back to Louis Pasteur, Edward Jenner, Jonas Salk, and also traces back to John the Baptist. Is literally the tradition of Gheuic cleaning feet as someone enters a house is one of the ancient precautions of our horse shepherd people. And so we ask that you join us at profi.me in our new Gheuic medical specialty.